WYPL TV 18 presents Health Matters with Dr. Mark Castellaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
Welcome to Health Matters. Merry Christmas and Happy Holidays. I'm Dr. Mark Castellaw with Baptist Medical Group. This is a very special time for many of us as we reunite with friends and family, exchange gifts, and enjoy our favorite treats. But it can also be a stressful time. It may remind you of a loved one who's passed away. You may feel overwhelmed with all the preparations you have to make. You may not be able to enjoy the hearty meals and desserts that often accompany holiday celebrations. You may have to spend the holidays in the hospital. This month on Health Matters, we've invited a group of experts to help deal with all these issues and more, because your health matters. Ho, ho, ho. First on Health Matters, this time of year can be especially difficult if you have diabetes or any chronic health condition. It's hard enough to eat healthy every day, but how can you avoid the cakes, the cookies, and other holiday foods served at holiday get-togethers? Well, oftentimes I don't avoid them, unfortunately. Joining us now to help patients with medical conditions enjoy this special time while staying healthy is Baptist Medical Group's endocrinologist, Dr. Shimon Harari. Welcome to be on our show today.
Thank you for having me.
Okay, you're an endocrinologist. You specialize in diabetes, but you also take care of other health conditions as well. What do these poor people do during the holidays when all of this holiday food is put before them? They're trying to do right. They're trying to keep their hemoglobin A1C down, but it's the holidays. What's your advice to them?
I generally tell my patients to try to keep a balanced focus. In general, just not to stray from the guidelines that we've been teaching them all along. Nothing really changes. There's more food and maybe more delicious food, but the guidelines of a generally carbohydrate-controlled diet haven't really changed. However, I tell all my patients that there is no food that they cannot have. They can have any food they want, ice cream every day, as long as the balance is there.
Did you hear that? Ice cream every day.
That's right.
Okay, go ahead.
But if you're eating more ice cream, you're eating a little bit less pie or a little bit less potato, less bread, the balance has to remain so the overall control is reasonable. So you can have the ice cream, but something has to give somewhere. That's what I tell them.
So if you have that piece of pumpkin pie or pecan pie, which is very good, then you skip some carbohydrates somewhere else. You skip the bread or the mashed potatoes or something like that.
The guidelines I give my patients are generally they have an idea of approximately how much carbohydrates you're going to have every meal. In a simplistic way of looking at it, if you had a plate, the carbohydrates should not be more than a quarter of the plate. And everything should fit in there. So they know that if they're going to stick in a pie in there, something else is probably going to come out. Otherwise, they will get in trouble. I also give them other tips that they can generally use when they're going to parties or to events or other people's houses where they don't have control over their diet or what they're being served. So one rule is if you don't see it, it won't bother you. If you're going to a party, try not to hang out at the big tables all the time. Go talk to the people. Don't hang out near the pies and alcohol per se. Alcohol, speaking of alcohol, alcohol can cause a lot of glycemic changes. Your glucose can go up and down, especially on an empty stomach. So you want to kind of have little tips to help you sort of get over those temptations that might be a little bit too much sometimes.
Now, do you tell your patients, especially the diabetic patients, to maybe monitor their blood sugar a little more often or closer during the holidays?
I actually do not in general. I try to have them in a place where no matter what they do or where they go, they are checking blood glucose enough times to keep good control. However, if they feel like they don't feel well or they know that they're outside their usual mode of eating, then I'll tell them to check a few more times. especially if they're having symptoms.
Now, during the holidays, of course, a lot of people travel. What's your recommendation to patients about traveling that has diabetes, that have insulin syringes? What do you tell them?
Well, regarding travel, or really anytime you leave the house, you want to plan ahead in a reasonable way to be prepared. That is true regarding diet and regarding medications. Whether you have an insulin pump or blood pressure medications or any endocrine or other chronic health issue. So I generally tell my patients, if you know you're going somewhere, please take a look at your inventory. Do you have enough vials, enough syringes, enough medication, enough tablets for what you're going to need? Especially if you're eating more, if you might be a little bit looser in your control, be prepared, because during the holidays, it's harder to get a prescription if you need it.
So it's important to make sure they got plenty of medicine before they leave and travel elsewhere.
Absolutely. It's important, even if you're staying home, you want to try to plan your meals a little bit. So you don't have to have that huge carbohydrate stuffing that you're in. You can make a more vegetable type stuffing. Add cauliflower and vegetables instead of pure potato. There are little tricks you can do to sort of decrease the carb load. One thing that a lot of my patients appreciate sometimes is the idea of Thanksgiving doesn't have to be about having huge amounts of leftovers. You can plan for the meal and make just the right amount of wonderful food, but once the holidays are over, they're over, and we don't have to keep eating the holiday type food for the next few weeks. That helps a lot of people.
Try to stay in the routine that you've already called them to do.
It's an exceptionally happy time, but we have to sort of retain our overall sense of control.
And we have a little bit of dressing, right?
Absolutely.
A little dressing.
Yes. A little bit of everything, but something has to give, I think.
And green bean casserole as well.
Sure,
you can have that.
Sure.
All right, well, thank you so much for being here today.
Pleasure.
Good to see you, sir. Coming up next, it's hard to find time for you to exercise during the holidays. Our next guest will give you some tips on scheduling workouts while still fulfilling your other obligations. Stay with us on Health Matters. Welcome back to Health Matters. This is our special holiday edition. Now, everyone knows exercise is an important part of living a healthy life. But how can you continue your normal regimen when you also have to buy gifts, prepare food, and attend parties, or even travel out of town? Joining us now with answer to these questions is a personal trainer and owner of Pike Yoga in Germantown, Wendy Holmes. Welcome being here today.
Thank you for having me.
Okay, holidays, crazy, bustful time, everyone's doing this and doing that. And all year long, you've been exercising, following your regimen, walking, jogging, whatever you do, working out in the gym. Then the holidays hit. So what are some tips that people can use to continue their exercising during the holidays?
Well, it's really important. I tell people to have a plan A, a plan B, and maybe even a plan C, because things just happen. I would keep your tennis shoes handy. That's your best piece of equipment. And other things would be like maybe instead of at the beginning of the year when everyone wants to make changes, maybe hire the personal trainer now, or get in a group where it's more economical and a little more fun to be with a trainer, so that you're accountable and you've already paid for your session, so you're more likely to go.
Now, when you travel out of town, of course, you're away from the gym that you use or away from the place that you normally exercise or walk. What are some of the things that people can do when they travel out of town?
That's a great question. What I do is, when I'm going to visit family, is thank goodness for the internet. You can actually Google, or look up different on the website places that will offer drop-ins. A lot of times my family is involved in a fitness center already, and sometimes they can bring a guest free 1 or 2 times. So I do that a lot, is look up. And again, maybe even just being with your family, visiting with them outdoors. Parks are good to use. If the neighborhood is safe, walk with the family members and just visit with them and exercise.
Well, during the holidays, our time is so tight. What are some exercises that give us the biggest bang for our buck, for the amount of time that you have to exercise?
Yeah, so little things like if you had to choose, I would say if you had to choose between maybe lifting weights and cardio at this point during the busy season, maybe not do the weights for a month and just really stick with the cardiovascular, because it's going to burn a lot of calories. And that's where we kind of run into trouble. We're eating and drinking more than normal, and so the exercising burns more calories to help us counter what we're taking in. And think in terms short term and maybe higher interval, like where you're elevating the heart rate and then bringing it back down, and then you don't even have to go as long if you're going harder than normal at a short period of time.
Now, what are some recommendations? We have patients that are wheelchair bound, or they have conditions that they can't walk, they can't exercise, they can't jog, and sometimes all they can do is sit in a chair. What are a couple of exercises that they can do to help their fitness?
Well, if they, everyone gets stressed out this time of year, right? So maybe even some breathing exercises to bring us back to a more centering and more calm environment, without knowing what their status is. If they can move their arms, even just lifting your arms, inhale and exhale big back into the center, are some different things that they could practice.
Okay, now you promised you were going to show me the yoga move of
that's
breathe.
right.
So show me what to do.
Exercise, and this time of year is also about being grateful, right? And having gratitude. So if you bring your hands to the heart center, so your thumbs are toward your heart.
First time I've done this.
And bring them to your heart. And so in your breathing, you're going to inhale through your nose, maybe to a count of 4. Inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4.
Well, that was exhausting. No, but anyway, all right, go ahead.
No,
all right, what do I do now?
So everything through the nose. So inhale for a count of 4. 1, 2, 3, 4. Exhale, 1, 2, 3, 4.
So something just that simple can be helpful.
Absolutely, help with stressing, bringing relief to a stressed body, clearing the mind, maybe even that, and then all of a sudden you realize you do have the energy to go exercise when you thought you didn't.
Say a word about being careful about tripping over things and climbing on ladders.
You bring up a very good point. As much as we want people to exercise, do be aware of your ladders and the extension cords that are in the yard, and we're encouraging people to be outside. But people do trip and get hurt this time of year, and you want to not get, we're already encouraging you to be outside. So dress appropriately for the cold weather. Watch for the box of lights that you got out of the garage and forgot they were sitting there and you trip over. So keep your awareness, don't be hurried, and practice your breathing.
Thank you so much. Next on Health Matters, while the holidays are a happy time for many of us, it can be a tough time for others, especially those grieving the loss of a loved one. A grief expert will talk about how to cope with that loss while still enjoying this special time of year. Stay with us on Health Matters. We're back to look at another side of the holidays. Traditionally, this is a time of year when families and friends gather and make happy memories. But for some, the holidays are less joyous because it reminds them of who they have lost in the previous year. Angela Hamblin, the director of Kimmons Wilson Family Center for Good Grief, is here to explain how celebrating the memories of those that we have lost can make the holiday season a happy time. Welcome for being here today.
Thank you.
Tell me what you do, and tell me about the Good Grief program at Baptist.
Sure. The Kimmons Wilson Family Center for Good Grief is a comprehensive grief center for children, teens, and adults. We offer individual grief counseling, grief groups, and camps throughout the year. It's completely free of charge and open to the entire community.
So anyone that may have lost a loved one or heaven forbid lost a child, then they can come to you and free of charge.
Yes.
And you will help counsel them through that very difficult time.
Absolutely, and the death does not have to have been within the Baptist system. It is open to the entire community, and we work with people who are dealing with all types of loss by death.
How do people access you?
They find out about us through many different ways. A lot of schools. We work a lot with our guidance counselors in our schools, churches, first responders, and other health professionals.
Well, today's program we're focusing about the holidays, and so the holidays are just fun time. Everybody's having a good time, but sometimes in those families where there's been a loss, there's a lot of sadness as well. So especially during the holidays, how do you direct your counseling for people?
Sure, the holidays can be a very difficult time for people. We live in a very mourning avoidant culture anyway. We have this mentality of we have to get back to work and after 3 days kind of just pick back up and move on. Well, the holidays come around and they're packed with emotions and memories and tradition, and a lot of times that brings people's grief to the surface, and they see that they really are maybe having a difficult time coping, and they get very fearful about the holidays. How are we going to survive? And oftentimes it's because of those traditions and memories. So we work with them to develop a plan for this holiday. Whatever we do this year to survive, to get through it as a family, is just for this year. It may not be what we do next year, and it can be different than what we've done before. I've seen families change their traditions in a way and really find peace in that. Even if we change what we do, we encourage them to incorporate that person into it. Say their name. Don't let the person who died become the elephant in the room. Incorporate them in. Talk about them. What are ways that we can still honor their life and keep them a part of our holiday tradition?
Very practical information. Very good. What are some of the things that we can do to honor those that we have lost during the holiday time?
I was actually working with a family just the other day who've had a child die, and they are trying to see what to do for themselves as the parents, but they also have younger children. And their child who died, they're worried about his friends. And they're going to have a holiday party where they invite all of their son who died's friends, and they're asking them to bring an ornament that represents their son to them. And they're going to have that's how they're going to decorate their tree this year. And they're going to have his favorite snack foods and really celebrate him. And I think that's a great way to bring his friends back to the home, to let the younger children see that, oh, we're not forgetting, we can still remember our brother, and that we can mourn together. We don't have to mourn privately.
Well, what advice would you give our viewers if they're going through the holidays right now and see that this is coming and they've lost a loved one? What's your best advice to them?
Really just to take it a day at a time, to slow down, to be good to themselves, to remember to keep themselves hydrated, to eat well, to get some exercise, and to rest. The holidays are such a go, go, go time, and oftentimes we're eating things and drinking things that maybe aren't very good for us.
Pumpkin pie, it's a vegetable.
It's
is.
Okay,
it's a vegetable.
And a slice, but really to take care of themselves and to do things in little small pieces. They don't have to do everything that they've done before, or to do things that honor that person who's died. Maybe do for somebody else in memory of that person. And really just kind of slowing down, giving themselves permission to do things differently this year, and that it doesn't mean that they're not doing well.
Well, some very great advice, practical advice. Thank you for being here today. Coming up on Health Matters, hospitals are open all day, every day, so some people can't spend the holidays with their loved ones. However, there's a department that brings the celebration to them. My next guest will explain. Stay tuned. Welcome back to the special holiday edition of Health Matters. I'm Dr. Mark Castellaw with Baptist Medical Group. Hospital pastoral care departments have a number of duties. One of them is providing a way for patients, employees, and visitors in the hospital to celebrate the holidays if they can't attend church or family gatherings. Joining me now is Reverend Anthony Burdick, Baptist Memorial Healthcare's System Director of Pastoral Care. He'll tell us how he and his colleagues tend to patients, visitors, employees' spiritual needs during the holidays. Welcome to the show.
Good to see you.
And Merry Christmas.
Well, Merry Christmas to you.
Now, the holidays are such a wonderful time and everyone's having fun and everything, but there are those that hurt during the holidays. They've lost loved ones, or heaven forbid, they're in the hospital during the holidays. So how does the pastoral care department at Baptist address these needs?
Well, we recognize the fact that, as you just alluded to, absolutely no one really would want to be in the hospital over the holidays. And so we try to do things as much as possible to provide a normal celebration for folks for their holidays. One of the first things you'll see at our facilities is, especially in the metro area, are life-size nativity scenes set up either inside or out on the front lawn of our hospitals to remind folks about Christ and the reason for the celebration at this time of the year. So we do simple things like that. We understand the dynamics, the spiritual and emotional dynamics that people are dealing with when they're stranded in the hospital over the holidays. Many of those folks are not just dealing with their own issues, but as you mentioned, they're dealing with grief issues, the loss of a loved one. That's particularly difficult at the holidays.
Now, also during the holidays, there's some people that may succumb to bouts of depression as well during this time because of instances they may have associate Christmas with. How do you deal with those?
Well, Baptist has a number of resources at our disposal. One of those things is the bereavement center at the Trinity Hospice House. The services that they offer and the resources that we can use there for referral purposes really are wonderful to help folks during the holidays. The folks at the bereavement center at Trinity provide educational opportunities for folks ahead of the holidays. The chaplains at the hospital will also be cognizant of that and help people deal with the things that they can anticipate having to go through at the holidays, especially if it's a first or second set of holidays without a loved one.
What is some of the words of encouragement and comfort that you give patients and family members that might be suffering during this time?
Well, first of all, we're always going to remind them of the hope that they have in our Lord, and point them to scriptural passages that would reinforce that hope. Then on the more practical side, I guess, and that's probably not even the best choice of words, but on another side, we're going to try to listen to what they're going through. And one of the things I've found helpful for a lot of folks is just to reassure them that they're not going crazy. The feelings that they're experiencing.
That it's okay to feel that way.
And they're discovering a new normal as they go into the holidays without a loved one. A lot of folks expect things to be just like it always was, or they force that upon themselves. And we try to help folks remember, give yourself the permission to do things differently this year. If you need to set aside some traditions, you can always add them back in later on if you want to. But give yourself permission to feel what you're feeling and work through this time. And don't overload yourself during the holidays.
And that's oftentimes part of the whole problem is you got so much going on as well, and then when you add this, sometimes it's just too much.
Yeah, you know, I can remember when my mom died, my dad felt like it was his responsibility to pick up all the things that she used to do during the holidays, and we had to come in and tell him, Dad, that's okay.
Not necessary. That's great advice.
You know, just do your thing, and we're going to help us all get through this together.
Well, thank you so much for being here today. Next in my Health Matters memo, more on healthy holidays, plus a special tribute to members of the Baptist Medical Group family. Stay tuned. And finally, in our Health Matters memo, as you prepare for another holiday season, remember that there's no gift as important as your health. And the best gift you can give your family and friends is yourself. As a physician, I've treated people who would trade good health for the best holiday gift or meal. Likewise, those who have lost loved ones would probably give anything to have them back for the holidays. This past year, Baptist Medical Group lost several members of our family. Renee McAllister with BMG, the medical group, Steve Wood with BMG Family Physicians Group, and most recently, Dr. Karen Gubin, a psychologist and wife of Stern Cardiovascular Foundation President, Dr. Steve Gubin. She was actually supposed to be a guest on this episode of Health Matters. Her focus was helping others through difficult times. Karen leaves behind her family and dozens of friends who will be spending this holiday season without her. I hope and pray that the family members of all of those who have passed away can find a way to enjoy this special time of year while honoring their loved ones. Your health is more precious than gold. Take what you've learned on this show today and do all you can to stay happy and healthy this holiday season. Don't let the pressure of finding the perfect gift or making the best meal distract you from the true reasons to celebrate. And now from us at Health Matters, have a happy and healthy holiday season because your health matters.
WYPL TV 18 presents Health Matters with Dr. Mark Castellaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.